Hello, Facebook fans and family. Thank you so much for joining us. We're going to talk about the coronavirus. Yes, we are. It would be a little weird if I started talking about other things. Believe it or not, we've had a lot of calls to the office about what we're doing, how we're doing it, if we're open, what the government says, what our governing bodies are going to say. And so tonight, we're going to just talk about some of that stuff so we can make sure that everybody is well informed about what to do if your child is having a problem. I just want to take about 10 or 15 minutes to kind of explain to you what's going on with the dental communities, in particular the pediatric dental community. A couple of weeks ago, hey Misty, thanks for watching. A couple of weeks ago, last Monday, to be exact, we've had to do all this. Hey, Brianna, good to see you, lady. We've had to make some hard, tough decisions for all dental offices. The American Dental Association, along with the American Academy of Pediatric Dentistry, the American Academy of Oral Surgeons, the American Academy of Orthodontists, the American Academy of Periodontists, we've all had to kind of step back and figure out what we needed to do. We have to take in mind that we have to make sure that our patients are doing well, because after all, we are a medical facility. And we have to also make sure that we're being safe. Those are the two top priorities of our office, of anyone's office. Every dentist I know has been affected by this. Just because we want to do what's right. So our governing bodies, along with the North Carolina Dental Board, has recommended that we only do emergency treatment. That means that if your child has pain, swelling, if they've been involved in trauma, or if they have an infection, that we can treat them, or we can at least get them out of the woods. We could triage them, which simply means we want to make sure that they get to the right place if this is not the best place to be. And then we want to make sure that we can get them out of pain. We were advised to be closed for about 2 to 3 weeks. And so we know that that's enough time for us to kind of get those patients in and get them out of pain, get them some information about what may be going on. And then we're going to make sure that they get to the right places. I see George and Bongo and Leanna. Thank you guys for joining me. So our decision to provide care is strictly based on the need of the patient. This is not because we're not going to do any cavities, because cavities are not an emergency situation, but it has to do with making sure that any pain, any swelling, any trauma, any infection is being treated and is being dealt with. Thank you for tuning in, Miss Stencil. It's good to see you. This is important because if your child or someone has a child who has pain, swelling, they've been involved in trauma, or they have infection, we don't want these kids to go to the ER or to urgent care. You can imagine that during this time, those places are absolutely slam jam packed with people who either may really need attention. And then we know that those kids that go to those places, they aren't normally able to be treated by the ER or by the urgent care. And it just happens to be that we're the tooth doctors. And so we've made the decision at our office that if you have a child, or if you know of a child who has pain, swelling, or trauma or infection, we will reduce our fee. We'll only charge you $100, and we will make sure that with an exam and an x-ray that we can determine how to get your child comfortable until the dental field is back open, until dental offices are open. We want to make sure that we're doing what we pledged to do in the beginning, which is to take care of our parents, take care of our patients, And I know I've talked to many parents who've had a child that stays up all night, or that you can't sleep or is swollen. That's very scary. And so we want to do our part. And if you simply visit our website, and you can contact us through there, you can call our office. We have a 24-hour emergency line that is always available. Me or someone who I've designated will always answer that, leave a message, but we'll always get back to you. If your child has any kind of emergency, we want to make sure that they are seen. We want to make sure that they do not go to the emergency room, do not go to the urgent care. We want to make sure that those doctors can concentrate on what we really need right now. The other question that a lot of parents have had is that they want to make sure that coming to a dental office is actually safe during this time period. And of course, again, that is the decision, that is the desire of every dentist in this time. Remember that dentists, we already practice what we call universal precautions. That means that we don't touch anyone unless we're wearing gloves and we're wearing a mask. That means that we wear scrubs. Your dentist we have control standards that make sure that we have to wipe down surfaces. Any surfaces that your child touches, we have to make sure that we wipe those surfaces down, where they sit, where their head is, if they touch anything that touches their mouth. We have a special way of disposing of any bodily fluids like saliva, like blood. Every dentist has to do that. That's a part of what we're mandated to do by every governing body that is there. So we already have those controls in place. Now, how are we stepping that up to make sure that no one is infected with the coronavirus, which, as you probably know by now, is a respiratory illness, or it's a respiratory virus that is transmitted by air. And the way that we do that, we have an improved screening process before you can even come to the office. And if your primary care provider has already probably introduced you to the new screening system that now we have. Anyone who's traveled, we're going to ask that you don't come to the office. Anyone who has been exposed, probably been exposed, we want to make sure that they don't come to the office. Then, of course, if you have a flu or fever, or if you've been traveling and around a lot of people, we don't want you to come to the office, and that's going to be part of our screening process going forward. The other thing is that we've expanded our surface disinfection. There's certain areas where the kids would play, and we would only disinfect that like maybe once a day. Now we disinfect those areas every hour. That's a part of what we're doing to make sure that everything stays safe and that we are killing that virus. Hey, Melissa and Ma Pat and Miss Crotts, thank you for watching. We appreciate that. Good to hear from you too, Christina. But we want to make sure that you're safe. So all the chairs where anyone sits, they are disinfected hourly. If you get up and you leave, and of course we don't see, we always see a reduced number of patients. We never have more than 15, 20 people in the office at a time. And because we're a medical facility, we want to make sure that we have even less than 10, which is the president's recommendation in the office at one time. The other thing that we're doing is that we're reducing the number. We have limited staff that come. And again, we're doing that to make sure that we can care for you in a safe way where you feel it's comfortable. The other thing that a lot of dentists are doing, if you have an emergency and you need to be treated, you're welcome to come to the office. You're welcome to stay in your car until we're ready to see your child. You bring your child in, and then your child comes right back out. So there are a lot of things that we're doing to make sure that your child is safe. These are also some questions that you may want to ask your dentist, which I'm sure that they're if you have a problem or if you have pain, that they're willing to at least talk with you and make sure that you're taken care of. That's what we were sworn to do. And even though we're not allowed to see any elective care, and many dentists have elected to close totally, I know that your dentist really cares. If you have a problem, if your child has a problem, you should always get us a call. We want to make sure that we're taking care of you. So remember, for this time period, if you're a new patient and you do not have anywhere to go, if your child is having pain, swelling, if they've been in a traumatic event, or if they have infection, we want to make sure that they get seen. And so for $100, which is a reduced fee, we will make sure that we examine them and get an x-ray and get them to the proper person and get them out of pain. That's going to be the biggest thing. Now, all that's out the way. If you have any questions, remember, I'm here to answer them for you. Hey, Miss Chantel, and we miss you too, Nicole. And we're going to have a coloring contest. I know that everybody's homeschooling now. I know that's a hard thing. I can't imagine what moms are going through, but we're going to have a coloring contest. Yesterday on our website, we sent out some coloring pages from the ADA, and we want your child to color those pictures and to take a picture and send it back in. And then we're going to give away a $50, and I forget what it's called, the Uber Eats or one of those. We're going to make sure that your family is taken care of. We want to support our local restaurants. You know, they're going through something too. And so we're going to give away a Uber Eats or a DoorDash gift certificate, because we want to help you and keep the kids entertained during this time period. So look out for that coloring contest. Look out for the rules. That's going to be any day now. We're going to start next week. So we wish you the absolute best. If you have any questions, if you have any concerns, please don't hesitate to give us a call. Our number, 24 hours, is available. We want you guys to stay safe. Thank you for joining me, and pass on the word. Take care, guys. Hey, Miss Burgess, y'all have a good one.